Climate change is the single biggest health threat facing humanity, and health professionals worldwide are already responding to the health harms caused by this unfolding crisis. The Intergovernmental Panel on Climate Change, IPCC, has concluded that to avert catastrophic health impacts and prevent millions of climate change-related deaths, the world must limit temperature rise to 1.5 degrees Celsius. Past emissions have already made a certain level of global temperature rise and other changes to the climate inevitable. Global heating of even 1.5 degrees Celsius is not considered safe, however. Every additional tenth of a degree of warming will take a serious toll on people's lives and health. While no one is safe from these risks, the people whose health is being harmed first and worst by the climate crisis are the people who contribute least to its causes, and who are least able to protect themselves and their families against it. People in low-income and disadvantaged countries and communities. The climate crisis threatens to undo the last 50 years of progress in development, global health, and poverty reduction, and to further widen existing health inequalities between and within populations. It severely jeopardizes the realization of universal health coverage, UHC, in various ways, including by compounding the existing burden of disease and by exacerbating existing barriers to accessing health services, often at the times when they are most needed. Over 930 million people, around 12% of the world's population, spend at least 10% of their household budget to pay for healthcare. With the poorest people largely uninsured, health shocks and stresses already currently push around 100 million people into poverty every year, with the impacts of climate change worsening this trend. Climate change is already impacting health in a myriad of ways, including by leading to death and illness from increasingly frequent extreme weather events, such as heat waves, storms and floods, the disruption of food systems, increases in zoonoses and food, water and vector-borne diseases, and mental health issues. Furthermore, climate change is undermining many of the social determinants for good health, such as livelihoods, equality and access to healthcare and social support structures. These climate-sensitive health risks are disproportionately felt by the most vulnerable and disadvantaged, including women, children, ethnic minorities, poor communities, migrants or displaced persons, older populations, and those with underlying health conditions. Although it is unequivocal that climate change affects human health, it remains challenging to accurately estimate the scale and impact of many climate-sensitive health risks. However, scientific advances progressively allow us to attribute an increase in morbidity and mortality to human-induced warming, and more accurately determine the risks and scale of these health threats. In the short to medium term, the health impacts of climate change will be determined mainly by the vulnerability of populations, their resilience to the current rate of climate change and the extent and pace of adaptation. In the longer term, the effects will increasingly depend on the extent to which transformational action is taken now to reduce emissions and avoid the breaching of dangerous temperature thresholds and potential irreversible tipping points.